for coming out, everybody. September 18th, 2021, Walk with the Doc. Two topics today. One is the cardiac consequences, or did the World Trade Center attacks affect people's hearts? And the other is what's on everyone's mind these days, or this past week, is the boosters. So we'll start with the World Trade Center attack, which, as everyone knows, was the 20th anniversary was last week. And I wanted to do a little bit of that today because, one, I wanted to honor the people that lost their lives and still had bad health effects from that attack and from helping out and doing the rescue. And there's still some things we can learn from what we've been seeing and following these folks for many years. So the World Trade Center Registry has been following survivors, firefighters, rescue workers, as well as people in Lower Manhattan who were residents and office workers at the time. And they've been following them all these years. And we know that there's been specific problems that have been occurring because of the consequences of the attack. There's been a lot of respiratory illnesses, like chronic cough. In fact, it's been named World Trade Center cough. They'll have sinus disease, asthma, bronchitis. There's also a lot of cancers that have been associated with people that were at the ground zero, including prostate cancer, thyroid cancer, and a number of others. As you can imagine, there was a lot of post-traumatic stress disorder as well. What's less publicized is that there really was some heart disease. So we'll talk about it in two phases today, right after the attacks and then the consequences years later. So in the immediate aftermath, 30 to 60 days after the attacks, there was an increase in heart attack and arrhythmias, as you might expect. One hospital in Brooklyn, which was 5 miles from ground zero, reported a 35% increase in heart attack risk compared to a previous year in time. Another study was done and looked at hospitals in New Jersey within a 50-mile radius. So I don't know for sure, but I'm sure Somerset was part of that. They noted a 49% increase in heart attacks, almost doubling of heart attacks. Now, in terms of irregular rhythms, people that have pacemakers, defibrillators, AICDs, they're followed by us in cardiology all the time. The device is there to help prevent sudden cardiac arrest, but it also stores any irregular rhythms. So when people see their cardiologist, we put a magnet over the device and can interrogate it, and we can see if there's any irregular rhythms. In the New York City vicinity, AICD patients who had been interrogated 30 to 60 days after the attack, there was an increase in ventricular arrhythmias, arrhythmias from the lower chamber of the heart, which can lead to sudden cardiac death. That didn't just happen in New York. In Florida, so many miles from the attack, again, AICD patients had a doubling of ventricular arrhythmias as well. Now, in terms of long-term effects, again, the World Trade Center Registry published in 2010, or 9 years after the attack, there was an increase in post-traumatic stress disorder found in 20% of women, 15% of men. And that's pretty high, because these are just normal folks, workers, rescue workers, firefighters, people in good shape otherwise. But they found an increased risk for hospitalization for heart disease and stroke, especially in patients that had post-traumatic stress disorder. The other thing that was published, 10,000 firefighters were followed for many years after the attacks. And then in 2017, or 16 years later, they published their findings. And there was an increase in heart attacks, stents, heart surgery, heart deaths in the firefighters that were at ground zero. And this is the raw numbers in the graph on the bottom of the first page. 2001, there's a very low incidence of heart disease in these young, in-shape people. But then you look from 2002 to 2017, dramatic increases in heart disease in all of these folks. It seemed to have occurred more if people were there early, when they were there when the towers came down, and if they were there for long periods of time. Those are the two big risk factors. So why does this occur? Why does heart disease occur with being associated with the attacks? There's really two mechanisms. One is dust and the other is stress. So the dust particles that were thrown into the air when the towers collapsed, the particulate matter is about the same size as what we see in air pollution. And we know in air pollution, people who live in polluted cities or around highways or airports, there's an increased risk for heart disease. So we know inhaling particulate matter, whether it's smoke or pollution or dust, increases the risk for respiratory problems as well as heart disease. Now, there was more than 1 million tons of dust that came down with the towers. So it was like inhaling pollution on steroids, just a huge bolus for people. And that's why the firefighters that were there when the towers collapsed and people that were there longer, they had the highest concentration, highest inhalation of dust. Now, in terms of stress, right after the attacks, there's acute stress reactions. And we know that's a trigger for heart disease. Acute stress reactions can cause heart attacks, and we know that happens in patients, in people that are affected by earthquakes, tsunamis. It's the same situation with the World Trade Center. You get this jolt of adrenaline, the sympathetic nerve system is all revved up, and if you have a vulnerable plaque in a heart artery, you're going to be at risk for a heart attack and for irregular rhythms, as we saw. Lastly, there's chronic exposure to stress. People with post-traumatic stress disorder, again, we know they're at risk for heart disease. And people who live in chronic fear of a terrorist attack also are at risk for heart disease. There was an interesting article out of Israel, and again, they've been at risk for terrorist attacks for 60 years. People that were living in fear of terror, an increase in heart rate, increase in blood pressure. And all of this is this fight or flight reaction. It's good when it's happening and it helps you at the time. But if it's chronic, if it's going on for years, it really causes damage to the heart, increases blood pressure, increases heart rate, increases inflammation, and promotes plaque formation in heart arteries. All not good things. So what can we learn from all this data from the World Trade Centers? One is we got to avoid airborne particulate matter. You know, try to avoid places where there's air pollution, dust in the workplace, wear a mask if there's, high risk for problems in the air that day. The other thing is stress. And it's a lot harder to avoid stress than it is to avoid pollution. You can do it, that's great, but we don't want you sitting in bed with your head under the covers. The other way to do that is to manage your reactions to stress. And exercise is a very good way to relieve stress. Other things like meditation and yoga, deep breathing exercises. We talked about laughter as a release for stress a couple of months ago. And pet ownership. Having a nice furry friend come greet you with a wagging tail certainly helps. So just a few things to help you out as we're going along and honoring these folks from the World Trade Center. All right, on to boosters. So before I do that, again, primary vaccination and vaccinating people that aren't vaccinated is the way to end the pandemic, okay? The vaccines still work. We're talking about primary vaccination is Pfizer and Moderna, the 2 shots, and the 1 shot of J&J. So I gave you this figure 1. It's this. This is the data from Pfizer, and this is what they submitted to the FDA yesterday. This is VE, is vaccine efficacy, vaccine effectiveness against infections, mild infections, severe infections. So we know early on there's a big efficacy. The line on top is all the other variants. The line on bottom is Delta. So within about a month, there's a 97% efficacy against the major variants, 93 against Delta. After 4 months, the efficacy goes to 67% for the variants, and still a pretty good 53% for Delta. Pfizer was showing a 6% reduction in efficacy every 2 months. And it's not related to Delta. It's just a natural progression where you lose immunity over time. It's not because more people are getting exposed to Delta variant. The same was true in Moderna. They sent out some data this week as well. The Moderna, you'd get severe infections. There's less of a risk within the first few months after Moderna. Higher risk more than a year out. The next graph, or the table, table 2, is the efficacy or the effectiveness against hospitalization. So not infections, hospitalization. So Moderna, right afterwards, and we're looking at the last column here, all the way over on the right. The Moderna, 93% early on, more than 128 days after full vaccination, it goes down to 92, so that's holding up pretty good. Pfizer early on was 88, 91, then goes down to 77%. So it starts to lose some effectiveness there against hospitalization. Janssen, 71% early, J&J, 71% early, down to 68, more than a month out. So also published this week on the last page, this is data from Israel. In Israel, in August, they started giving third doses booster to their population. And the Israeli health minister was quoted in the New York Times yesterday saying that they were seeing an increased risk of hospitalization in their prior vaccinated patients. That's why they decided to do the booster. They have a good, national health system, so they were able to follow these people. And again, it's 1.1 million people that they reported on. They're 60 years of age or older. They got a booster dose of Pfizer, and it was the same dose as the primary dose. So infection in the booster group was 934 versus 4,000 in people that didn't get booster. And the non-booster group, remember, had the 2 primary vaccines. Severe illness in the non-booster group was 294 versus 29. And they quoted a 19-fold reduction in severe illness with that third booster. The data looks pretty compelling. There are some other things to consider, though, and there's been a lot of controversy over this. In fact, 2 FDA scientists quit this week and wrote an article or an opinion piece in Lancet. That's where I got some of this info. The Israeli data, they only followed them for a week to 12 days. There wasn't long-term follow-up. This is really the only reliable data on the third shot. Now, the reduction in efficacy against mild disease doesn't necessarily protect reduction in protection from severe disease. We know the antibodies will go down over time. There's other mechanisms that the body uses to protect us. One is memory responses and these cell-mediated immunity responses, which are longer acting. They lay dormant, you get exposed later on, years later, and it activates it. Other point that is important, no variants have evolved that have escaped vaccine control yet. Lastly, the side effects from Israel, 1.1 million people, weren't any worse than with the original vaccine. We do know that myocarditis or inflammation of the heart muscle can occur 1 to 5 cases per 100,000 people. So now we're talking, boostering tens of millions of people. Do we want to take the risk that some of these folks will get an infection of the heart? So, bottom line is that the evidence is solid for people over 65, that there's lower immunity over time, the boosters are safe, and the boosters increase immune response. 18 countries have already approved the vaccine booster for people over 65. The UK, United Kingdom, has boosters for people 50 years of age and older. there is less evidence, but maybe a suggestion that if you're over 40, that the boosters would help as well. But it's not quite as solid as for older patients. And in the 18 to 40 years age, we just don't know. So yesterday, FDA meeting, Pfizer went for a home run, asked for boosters for everyone over 16 years of age, and it was rejected. Probably because the data here just isn't as solid, and they didn't want to open it up to that many people. They did approve a booster for those over 65 or those who are at risk for severe infection, such as people in the healthcare industry or teachers. So we'll see how that plays out over the next month or so. I'm sure we'll talk about this again next month. All right, I'll stop there and see if you guys have questions. I'm sure there will be.